Today, we will talk about hand hygiene during the COVID-19 pandemic. As we all know, washing our hands properly is one of the important measures we take to stop the transmission of COVID-19 to our bodies. And we touch so many different surfaces every day, all the time, and we transmit so many different bacteria and germs. And this is a list of the different things that can be transmitted to our body. And the coronavirus have been added to this list with all the knowledge that we've acquired during this pandemic about this virus. This is a study that was just published this early this month, and they looked into adult people in the U.S. Into how often they would remember washing their hands in different situations, and this was done before and during the pandemic. And what's interesting that we should expect that washing our hands after using the bathroom is 100%, but that was not the case. Less than 90% of the time when we use the bathroom at home, and less than 95% of the time when we use the bathroom in public. Yes, it's improved a little bit after the pandemic, but it's still not good enough. And if we have cough symptoms, coughing, sneezing, or blowing our nose, less than 72% of the time, uh, we wash our hands. And women across the board have done better than men, but still, the numbers are still overall not better. Um, Before eating at home or eating at restaurant, the percentage still not ideal. 70 less than 75% of the time when we wash our hands before eating. And this topic have been studied so well in the healthcare settings. So we know that as a healthcare worker, we we need to wash our hands on average 100 times in a 12-hour shift, and less than 50% of healthcare workers would do this 100% of the time. And this would affect patients really immensely. So this is a study that happened when this person got ended up touching a surface with bacteria on it. That's we know it's one of the most common bacteria. It's called MRSA, and this bacteria was cultured from their hands. And when this person washed their hands properly, this bacteria was gone. So we know that hand hygiene saves life in healthcare settings, but this would also apply to all of us in public, where we encounter so many different infectious agents that could affect our own health. So it's not just important to wash our hands for 15 seconds, but also the quality to get every surface on the hand, including between the fingers, rubbing the fingernails and around the thumbs. And if we don't find soap and water, we would use hand sanitizer. So 1 out of 4 people would not remember washing their hands in these settings, and this is definitely very important to remember, that we need to remember washing our hands after using the bathroom, before and after eating, if we have respiratory symptoms, if we're touching surfaces or we're touching our mask. Thank you.